A recent study finds more younger women are developing breast cancer, but women under 40 often get conflicting advice about prevention and face unique challenges once diagnosed. October is Breast Cancer Awareness Month, so we wanted to get some answers. And Dr. Donna McNamara is the Chief of Medical Gynecological Oncology at Hackensack University Medical Center. She joins us now with her patient, Rachel Bograd, who was diagnosed when she was just 31 and pregnant. Good morning to the both of you.
Good morning.
And Rachel, how shocking was it when you got your diagnosis?
It was extremely shocking. I could have never imagined I would get diagnosed with breast cancer, let alone get diagnosed while pregnant. I really wasn't aware of that much family history. I had a great aunt who died of breast cancer on my father's side, but it turns out that I do carry a genetic mutation, the BRCA1. And that's how I got diagnosed.
I mean, just 1 minute you're expecting, then dealing with a serious disease. I mean, how did you react when you heard?
Not well. It was extremely upsetting. I was really just shocked and terrified and, so concerned about my pregnancy and, my son. They wanted to start me on treatment right away, which was really overwhelming because I didn't know that I could get chemo while pregnant.
Sure.
But turns out you can.
And doctor, why are younger women getting cancer in general and breast cancer in particular?
Good question. I think that the increase in early onset breast cancers is likely associated with a number of factors. These could include the increasing incidence of obesity in the United States and the changes in lifestyle, such as having children at a later age compared to many years ago. Not having children or having your first child after the age of 35 is actually a known risk for breast cancer. Reduced activity, environmental factors, and exposures likely also play a role, but those are more difficult to pinpoint.
And do you think, doctor, screening should start earlier?
So, as you're probably aware, earlier this year, the United States Preventive Services Task Force did change the recommended age for women to start mammography from 50 to 40 years, finally catching up with what oncologists have been recommending for years. In regards to screening women under 40, this is only recommended for women deemed to be at high risk. These are women with known genetic mutations like Rachel with BRCA1, predisposing towards breast cancer, or a strong family history. There are also a number of predictive models that we can use to calculate the risk of breast cancer, such as the Gale model or Tyrer-Cuzick. If your lifetime risk of breast cancer is calculated to be over 20%, screening would be recommended with an annual mammogram alternating every 6 months with an annual MRI. Now, for women that are under 40 at average risk, not meeting any of the above criteria, regular mammograms really aren't recommended, in part because breast tissue tends to be so dense and making evaluation difficult. There was actually a study done looking at over 70,000 screening mammograms in average risk women under 40, and the positive predictive value was only 1.3%. That means if the mammogram has an abnormal finding, the likelihood of it being cancer is only about 1%. So you'd be doing excess procedures, causing physical and emotional discomfort for a very small likelihood of true disease.
And Rachel, how are you doing now?
I'm doing well, thank you. And most importantly, my son, Noah, is doing amazing. He's 6 months. He's really thriving. So really, really thankful for the treatment that Dr. McNamara was providing me. And I'm still in treatment now, but just to make sure we've got every last cancer cell and that it doesn't come back. So I'm in radiation and immunotherapy.
Sure. I am so glad he's doing well. We got to see some adorable pictures of him and 6 months. What a beautiful age. Now, when you found out and the doctor recommended treatment, I'm sure that must have been a difficult decision as to what to do there.
Yeah, although Dr. McNamara made it pretty easy, she really assured me that this was, going to be fine for my son and really vital for me. And she talked about patients she had had in the past who were pregnant, who all were doing well and had healthy babies. So that really helped hearing. And it's always helpful to hear stories of other people who've gone through it and are doing well.
Yeah, I wanted to ask your advice, Rachel, on other young women who might be diagnosed. What would you tell them?
Yeah, I would tell them to really pay attention to their family history, really get into, both their father's side and their mother's side, not just their mother's side, and to go back in their history, not just their parents, but their grandparents. And also to do self checks the first of every month. And then I think lastly, just to really listen to your body and to advocate for yourself because no one knows your body better than you. So really to speak up if you feel something different from your baseline.
Such great advice. And ladies, thank you so much for taking some time to talk to us. Rachel Bograd, Dr. McNamara from Hackensack University Medical Center. Thank you both for joining us. And for more researches on breast cancer, you can go to our website, cbsnewyork.com.